everyone. Thank you for participating in the Wellness Wave brought to you by ACP SoCal Region 3. My name is Lena Brady, and I'm a medical student at UC San Diego School of Medicine, representing the California ACP Chapter 3. Today, I am so honored to interview Dr. Hamori. Dr. Hamori, could you please share with our ACP viewers a little bit about yourself and what you do?
Okay, so I am what's called a general internist, and I like to refer to myself as old school. And by that, the bulk of my practice is adult primary care. So seeing patients here in my office, you got to be kind of at least 14 to 16 to get into my practice. And my oldest patient is just short of 100. So everything in between. The bulk of what I do is adult primary care. Now, I'm with a big medical group, Kaiser Permanente. I also do some administrative work for the group. I spend a fair amount teaching residents. We have UCSD residents who rotate through our offices. And so right now I'm mentoring a first-year resident and a second-year resident. I went to UCSD for medical school. Yay, I loved it there. I stayed for residency, was chief resident for a year before joining Kaiser in 1997. So it's been a great career.
Wow, thank you so much for that introduction. And it seems like you're very busy in different fields of medicine, administration, and education. So going off of that, my next question is, how did you choose your career path in medicine?
Yeah, so what you will find is when you get to your clerkship rotations in third year, something eventually kind of speaks to you. And as I kind of went through each other specialty, really for me came down to internal medicine and pediatrics because I like the primary contact with patients. And there weren't really very many med peds residencies back then. And I had, not that I didn't have good mentors in pediatrics, but I had great mentors on my internal medicine rotations. Some people who are probably still around that you may bump into when you get to your clerkship phase. And that really is what kind of sealed the deal and haven't looked back since.
Mm-hmm. Yeah, thank you for explaining that. And so reflecting on your own experiences going through that process, what advice do you have for rising medical students and current residents as they are trying to figure out their own paths in medicine?
Well, I'm now 25 years almost with Kaiser. You have to get up every day and do something you love, because that's what really, I set an alarm, but I'm always awake before my alarm. I love what I do. I love showing up at the office. And that's why I say through your third year and possibly into your fourth year, the clerkships, they'll kind of talk to you. You'll find work that you find really rewarding. Contact. That longitudinal care, getting to know people over a lifespan. And I've got people that have been with me 25 years. I saw a woman just, was it yesterday? I mean, we've been together longer than most marriages. So, it just will talk to you at some point in time. You just have to listen. You've got to do, what's in there because you've got to get up and do it every day for 30 years.
Mm-hmm. Yeah, I think that is wonderful advice. So thank you so much for sharing that. And now shifting gears a little bit, I wanted to mention that you were recently the former governor for our ACP local region. So I was wondering if you would want to share a little bit about that experience.
Wow, that was an absolute fantastic experience, I will say. It's a 5-year commitment. You spend a year as the governor-elect. And that's kind of just learning the ropes. You attend the meetings of the Board of Governors, but not as a voting member. And you get to know the people that you will be working with. The ACP governors, the Board of Governors is divided into classes, much like medical students are into classes. So I was the class of 2021. There were 18 of us in that class, and each class had approximately the same number. And so you work very closely with that group on generating ACP policy. So you get to really know them very well, their partners, and they become friends. For anybody kind of starting out in ACP or in organized medicine, whatever your professional society is, getting involved as a medical student is great. I had been sitting on the ACP Governor's Council, and in each local chapter does have a governor's council. I'd been on that for maybe a decade, maybe longer. And that allowed me to get to know the local ACP people, local ACP leadership, that allowed me to then step up into the governorship.
Mm-hmm. Yeah, thank you for sharing that experience as well. And since you have a lot of experience in leadership, for example, your service in ACP, what advice can you share on creating a culture of wellness in medicine on a systemic level?
For anybody in leadership, you have to own how you run things and how you make expectations of people. And you shouldn't make expectations on people that you wouldn't really want for yourself. And you may even actually say, okay, hey, look, I'm this outlier. Like one of my mentors, he used to say, his work is his life, so he has perfect work-life balance. Right. Okay. There are people on that spectrum, but most of us who want to be somewhere in the middle, we shouldn't push too hard. So I think, the best thing a leader can do is, after doing a period of service of leadership, going back into the trenches and practicing in the environment that they created. And if they're willing to do that, then I think they focused reasonably well on wellness.
Mhm. Thank you for that. And to finish off our interview, Dr. Hamori, do you have a wellness quote that you would like to share with our audience?
Yeah, a wellness quote. I've got two of them actually for you. The first one is it's from a card my wife gave me. And I have a bulletin board, which you can't see. Maybe let me see if I can move my camera. So I've got a little bulletin board over there. It's got mostly pictures of my kids as they were growing up. I've got two daughters who I absolutely adore. But my wife gave this to me, and it says, "Peace, it does not mean to be in a place where there is no noise, trouble, or hard work. It means to be in the midst of those things and still be calm in your heart." And I think that for all of us in medicine, I don't know. I mean, look, you're experiencing it as a first year student. Wait till you're in your first code blue as a third year, and people are yelling and screaming, and it is chaotic. You've got to be the adult there in the room. You're in the midst of that chaos, but you have to find that calmness within yourself. The second quote is not really a quote as much as it is a picture. I'm a different generation. I don't know if you remember the Far Side cartoons from Gary Larson.
Not familiar, no.
Yeah, so this was kind of an 80s thing into the 90s. And I'm going to just see if I can get this up there where you can kind of see it. Okay, and so you can see as a picture, you got two devils there. You got the flames of hell. And the caption reads, there's a guy with a wheelbarrow whistling a jaunty tune. And the caption says, we're just not reaching that guy. And so that's kind of almost a corollary to the first quote. You might be amongst all of this stuff. You have to find that in yourself. And that takes work, and it takes practice, and it takes self-care, allowing yourself the time. And I think that oftentimes in the chaos of what we do, we don't give ourselves that time. So those are my two quotes for you.
Wow, I really enjoyed the quote and then the cartoon. I think that is great wellness advice that I will definitely implement into my own life, and I'm sure that the audience will really appreciate.